This is a webinar under the theme Built to Last, because Evo is a company that's focused on women's wellness, and we have a specific focus on bone health. Obviously, the body is connected, and we'll go into that with you, but our focus is bone health. Our first product is a weighted vest, the Evo Warrior Vest, but we're excited to talk about all aspects of the body. As you know, like the person that is coming to one of our rocks or is wearing a vest obviously also is interested in the right nutrition for the body, like to age healthily, and build a body to last. So with that, I'll kick it off. And today I'm so excited because we have Dr. Riteesha Reddy, who is the medical director of Canyon Ranch, and also rheumatologist and lifestyle medicine physician. And you were named the best doctor by D Magazine 7 years running, I read. I love that now you're bringing a whole person approach to health. So from joint and bone health, but also to nutrition, movement, and sleep. So welcome, excited to have you here.
Thank you.
And the way this webinar works is, first I'm going to ask you to give a little background, but then we have actually quite a few questions from our community, from people that are interested in your background and have specific questions. So I'm trying to go through a lot of those live. If anyone else has any other questions, please feel free to add it in the chat and hopefully we can get to it. Okay, but let's kick it off. I would love to hear your background from rheumatology and now over to like the more holistic women's health. Like, what was your journey? And yeah, like take us through that and
Sure.
why you're on this mission right now.
So thank you, first of all, for having me. And I'm excited to share, about my personal journey and where we are at from a Canyon Ranch standpoint. I think for myself, I grew up in Central Texas. I went to college and medical school at Brown University in Rhode Island. Then I did my internal medicine and rheumatology training at the University of Chicago hospitals. And, it was a very academic environment. And I trained with some of, the foremost academic thought leaders in internal medicine and rheumatology. And then I eventually settled in Dallas and started working there about 20 years ago. And, rewinding a little bit to my childhood, my parents both worked full time, and I often would go to India. That was my summer camp. I'd go to India with my grandparents, and there, on my father's side, they were farmers. And so I remember going out into the fields and you get thirsty and then you chop down a coconut, climb up the tree and, hack it down. My grandmother would ask me, what do you want for dinner? And we'd go out and just pick it from the fields. And so it was very natural for food and for physical movement to be just a part of everyday life and connection and all these things. And so it wasn't until later when I started my career that I felt like there was a missing piece. And I felt like I had the academic background and the knowledge and, knowing about medications and knew kind of how to diagnose and treat rheumatologic conditions. But I felt like I had something more to add. And just from a common sense approach and from my own life experience approach. And that's when I began exploring. So I did the integrative medicine fellowship through the University of Arizona, the Andrew Weil program. And I gave talks and grand rounds and different things. And this is, more than 10 years ago at this point. And when it was still kind of frowned upon in some academic circles to talk about nutrition and other things. Then subsequently, I did the lifestyle medicine board certification. And then more recently, I'm menopause certified. And so why did I pursue all of this? I think it's allowed me to have the framework, really the framework, and study the data and the evidence for what I, sort of naturally understood and grew up around. And I really believe in giving kind of the best of both worlds in patient care, kind of what's the best of modern medicine plus what else can I do, doc, that's not in the form of medication. So that's how I'm here now.
Yeah. No, this is such a rich background. And I think it's important to say like that you are classically trained, because I think especially with like nutrition and sleep, we often see a lot of people that, find an interest in it and are coaching on it. But I think that's where I love that also with Canyon Ranch, like overall, right? Like the type of experts you're bringing in have really years of experience. So, and then just anecdotally, you telling the story from India where you grew up. I lived in Asia for 6 years. So I feel like also got to really appreciate the you know uh or how to complement a Western medicine and where the holistic body is like kind of already in the Asian Southeast Asian cultures a
Right.
complete norm that it's like the medicine is including all that. So yeah, great background, thank you for sharing. And now, so to make sure we cover everything, I'm just going right into some of the questions. And I think a lot of people know your background with rheumatology, so that's why some of the questions are related to joints and bones. Yeah.
Sure.
So there was someone who asked if joint pain is just aging or something else.
I hope it's not just aging, because we're all aging.
Yeah.
Um, I think so much of it has to do, I mean, yes, somewhat with aging because our body's not naturally as resilient. We don't have as much in terms of like growth factors and that sort of thing, but also hormones are a huge part of it. For women specifically around that perimenopause and menopause transition, estrogen kind of leaves the room, and the hormonal changes that come during that transition absolutely increase joint pain and mobility. And also, as people just sort of do less, like I know so many people that say, I used to run, or I used to do
Hmm.
marathons, or I used to ski, or these kinds of things. And so, even just those subtle changes in what we do changes some of the mechanical stimulus for bone, and then also for muscle, the type of muscle we tend to lose the fast twitch fibers a little more so as we get older than the other muscle fibers. And so it has to become intentional to protect your body and to stay mobile and not in pain.
Yeah. I like that you're saying like it has to be intentional, right? Like because I think we're moving from, oh, we're active doing a lot of things, and then, to, oh, something is aching here and there. So being more
Yes.
intentional, I think, is good. I'm moving right to a different question that Jacqueline had. What are the best exercises for women when it comes to bone health, especially as we age and specifically in perimenopause and menopause?
Yes. So that's a great question. I think I'm assuming this is a pretty educated and informed audience. We now know that resistance training, progressive loading, meaning, progressively increasing the amount of weight and the load on your musculoskeletal system and on your bones and muscles, etc., that helps protect and increase potentially your bone and muscle strength and health. And in terms of exercises, I think the resistance training at least twice a week is super important. Sprint interval training is great for kind of getting some cardiovascular exercise as well there. Zone 2 exercise, not specifically for bone, but just for general cardiovascular health and whatnot. And then jump training, that the bone really needs the mechanical stimulus that it gets from the impact. And so jumping exercises are important for that. Kind of going back to aging for a moment, one thing I wanted to mention is a term called sarcopenia, and sarcopenia means muscle loss. And we, generally speaking, with the aging process, after about the age of 60, I'll just say, perhaps even sooner than that, but there is a sarcopenia of aging where you lose, depending on what study you're reading, anywhere from 1 to 3 ish percent of muscle mass per year with just normal aging, which is pretty significant. That adds up. That adds up fast, and so that's why it's just so important to do those exercises, even to maintain, let alone to strengthen and build.
Mhm. Yeah, we love jumping. So for everyone who's on here who joins our in-person walks where we walk with a weighted vest, we always incorporate jumping. So
Oh well.
that's a great validation. Yeah, that impact, right, for the bones is great. And luckily, there's a lot of studies that support that. Um, okay, then there's another question on bone density with osteoarthritis. And
Mm.
maybe for the ones that don't know the difference, maybe you can quickly explain osteoarthritis and the difference to arthritis. And I guess the question is like, what is safe, right? Like, what can I do in order to build bone despite the
Mhm.
condition?
So that's a great question, and one that I get commonly. I think it's important to um, I think it's important to understand that walking is safe even with arthritis. It depends, a lot of it depends on where you have arthritis. And so, if we're talking about just general walking or general exercise, a good rule to follow is whatever activity it is that you do, if you feel pretty stiff and sore, or if you're in a lot of pain 24 hours later, then probably pull it back a little bit and start, slower and gentler. Your bones and your joints especially don't always tell you when you're doing too much in the moment. They tell you a day later, a day or two later. And so, what is arthritis? Well, osteoarthritis is really the full name for what most people refer to generally as arthritis. And it's really, historically we thought of it as more of a wear and tear type of arthritis, where there's just, mechanical loading, and over time the joint gets kind of worn out. The bone will hypertrophy and get sclerotic, and there can be some areas of overgrowth. You've probably heard of osteophytes. If you've had x-rays done, you might see some bony overgrowth there. It's sort of, think of it like a callus, right? If there's too much wear and tear there, you'll get some of that bony overgrowth. In addition, you can get cartilage thinning, and that's when people get, quote, bone on bone arthritis on, say, knee x-rays or that sort of thing. But to answer the question about is it safe, I think generally speaking, hip and knee arthritis, for example, it should be safe to be able to walk, and even walking with a weighted vest. I'm pretty cautious in folks with spinal arthritis, because that axial loading can strain, the facet joints and other things, and cause a flare in back pain. So I am cautious about that. But for the others, I think it should be pretty safe. Also, the muscles, you're loading the muscles, and the stronger you are, and the more muscle you have and flexibility and all of that, then the more you're protecting those bones. And so I've seen folks who have, quote, bone on bone arthritis, but they have good muscle strength and flexibility and whatnot, that they don't hurt at all. And I've seen others with normal x-rays, so no arthritis, but yet they have significant pain because their strength isn't there to protect the skeleton and protect those joints and bones.
Yeah. Okay. That's also always a good reminder that like bones and muscle work
Yes,
together and that
absolutely.
one helps the other. So,
Absolutely. If you think of a skeleton, it can't move, it can't go anywhere. It's just sort of there. It needs the muscles and all of the soft tissues for the locomotion, for the
yeah,
movement.
yeah, yeah. I'm working on both. I know bones take a longer time, but especially my arms. There's a few people that know there that I have as a goal 10 pull-ups at the end of the year, and at the moment it doesn't look great. So on that.
Kudos to you. That's a fantastic goal.
Yeah. Okay, so then there's a question by Brooke, and she said if bands and Pilates are as effective for bone health as weight training. I guess
Mm,
that's the
that's a
question.
great question. Yeah.
And we hear that a lot, right? Like Pilates versus weight training. Is there a
Yes.
one or the other, or yeah, what is your take on that?
I mean, I think at the end of the day, what's really important is that you're enjoying it, whatever form of exercise you choose, that you enjoy it and that you're consistent about it, right? So if you are someone that doesn't like the gym, but yet you go and you're just a warrior for a day and you go all out, but then you're sore and in bed for the rest of the week, well, that's not as effective as going to your Pilates class or doing your band exercises, doing that consistently, several times a week and being able to maintain it. So I think that's the first thing. But oftentimes with band exercises and Pilates, especially like mat Pilates, you're not weight bearing, you're lying down, and so those bones, the weight bearing bones, like your low back and your hips, for example, which is what gets measured on bone density exams, they're not getting the mechanical load that's needed and that strain and that sort of thing. Also, when you are doing weight training and jump training, that kind of thing, you're stimulating that mechanostat. You're giving it the mechanical strain that is important for osteogenesis or building bones. So it's not only the load that's important, but it's also kind of the rate of strain and the force and the impact and direction, all of that that's additive.
Right. Yeah, we just see Leah in the chat. She's saying Pilates reformer jump board. I guess
Mm,
that is a form of jumping, but if I hear you correctly, it's dependent on the person how much they're jumping, and there's obviously not the same impact as kind of jumping from the ground up and down.
right. I'm not familiar with any studies that look at I think she must be referring to the rebounder on those machines when you're lying down, and I'm not sure
Yeah.
that that gives enough impact. I'm sure it's great for cardiovascular and for muscle building, but specifically for bone building, I'm not so sure. I am a fan of working out on a rebounder for, sort of home exercises, and particularly my patients with arthritis and that sort of thing, because it's a nice way to introduce jump training, and
Mm.
especially if you have a balance bar, because rule number one, don't hurt yourself and don't fall and get injured. But that's a really nice way to stimulate sort of the muscles, the bones, the joints. Works on balance, right? You have to balance is important. Nobody wants to fall and break something. So um, I think that's helpful for an introduction to jump training.
Oh yeah, that's a great point of like for people with arthritis, that is like a great
Hmm.
kind of easier way to get into jump training.
Hmm.
Okay, so last question on kind of weight bearing or resistance. April asked, how much extra bone benefit would you get from wearing a 16-pound vest instead of a 12-pound vest?
Hmm.
And she might ask this because if she's, has one of our Evo vests, it is adjustable, so you can go from 0 to 20 pounds. And we're not doctors, but we do recommend to slowly ease in. And I guess,
Yes.
um, yeah, that's why I guess now the question.
So I'm not. I'm correct me if I'm wrong, but I'm not familiar with any studies that look at the bone building, results of, or potential bone building results of one versus the other. I think that comes back to sort of the mechanical strain. I imagine if you're wearing a heavier weight vest versus a lighter weight vest, and you're doing like jump training or that sort of thing, certainly you'd have more of that osteogenic stimulus. I think if you were just out walking, I'm not sure that one versus the other would necessarily be um, significantly make a significant difference specifically for bone building. Now, when it comes to say cardiovascular health, I think absolutely, it's probably much harder to walk with a 16-pound vest than a 12-pound vest. We usually recommend starting about 5% of your body weight if you're new to walking with a weighted vest and that kind of thing. And I think most people just by walking will get significant cardiovascular benefit out of it.
Yeah. Okay. That's also what we recommend. Usually start with like 5% and go
Mhm.
up around 10% just as a guidance to have that like enough impact, like you said, like
Mhm.
to increase that body weight. But yeah, we're also currently working with or we have a lot of conversations with the University Wake Forest because
Mm.
they have a study, the INVEST study for bone health, currently more focused on weight loss.
Okay,
But stay tuned. So,
that's
we'll share
exciting.
more. Yeah, we'll share more once we, learn more.
Great. Yes,
Um,
we need more studies
yeah,
in this with weighted vests because there's so much interest and it's just such a user friendly way to get more benefit from the exercise that you are doing. So yeah,
exactly.
that's
Yeah.
exciting.
We always see it as like a great compliment or like start to your bone health journey because um like I hope everyone in our community knows it does not replace lifting or replace proper
Correct.
resistance training. So but it often helps to empower, like myself included, everyone to feel stronger and like then, feel better about lifting and resistance training. uh,
Absolutely. I think it's just such a great way to start exercising. I have so many patients who, let's say, may have like an inflammatory arthritis. So people that have, say, rheumatoid arthritis, where the joints are swollen and painful, and there's true systemic inflammation. And then once we get their symptoms, improved and whatnot, then they want to start back to some exercise program. And so I think that's where weighted vests can really be quite helpful is you want more than just walking. And so a way to get more benefit out of it. And then you can just, increase as tolerated. I just moved to the Texas Hill Country outside of Austin, and so there are lots of hiking trails all around me. And as I was moving in, I saw people in the neighborhood walking with their weighted vests all around. So
yeah, yeah,
yes, so
it's
much interest.
yeah, exactly. And it's a great community building and yeah, so many benefits.
Yes.
Okay, let's shift because we said a weighted vest is not the only tool. It's, a whole area of like resistance training, but also nutrition. And so we have a
Mm.
couple of questions of, um, for example, Bonnie said or asked, how do I know if I'm getting enough calcium to keep my bones strong?
Mm. So the body is pretty good at maintaining a normal serum calcium level, and so if you're not getting enough from your diet and kind of the intestinal absorption of calcium, then it will leach from bone in order to be able to maintain adequate serum levels, and so you may have declining bone density, and if you got your serum calcium level checked it would still be normal, so that is potentially confusing, and I appreciate that. I think if we're talking about from a bone density standpoint, I think really the only way to know is to get a DEXA scan and to measure that. That said, the vitamin D, which goes hand in hand with dietary calcium, vitamin D level being checked. It's not always checked on standard, annual physicals and that kind of thing. And that is very important because the, majority of people in this day and age are cautious with the sun and UV protection and all of these things. But it's so common to have vitamin D deficiency, and that's very important to maintain good levels for bone health
Yeah.
and other
Okay.
things.
Yeah. Okay, I know we're we will maybe do a couple more questions, so
Sure.
we might run a couple minutes over. But you were just mentioning DEXA scan. Someone asked how often should we get a DEXA scan?
Mm. So the official guidelines are that for a healthy woman, the screening begins at age 65. And then you check every 2 years if they're in good shape. Then for women with risk factors, you can check sooner than that. So, for example, in my practice, I'll have patients with rheumatoid arthritis or who have been on steroids, glucocorticoids, for whatever amount of time in the past, and so those are risk factors for early, osteopenia, osteoporosis, and so I can check earlier in them. I would say insurance may not cover it, but I think this is an area where it's absolutely worth checking. We know with just paying for it and getting it checked about, we know that peak bone loss starts happening in that perimenopause transition beginning about a year before your final menstrual period, and even 1 to 2 years after. That's the time of greatest bone loss. And so if you wait, and we know that in the average woman, that menopause occurs around age 50.8, 50, 51, plus minus, say 5 years. And so if you're waiting until age 65, it's probably a little late. And I think that's a real care gap that we're facing. So I like to check it closer to age 50, plus minus, however many years, depending on your symptoms. If you notice that your sleep is getting dysregulated, that's often a first sign of perimenopause, and other symptoms, but also irregular cycles. So I like to check it earlier, every 2 years, if they're doing well. If you've made some sort of change or an intervention, it's reasonable to check it after a year. But really depends on the individual person.
Yeah. Okay. Awesome. A couple of questions that maybe we'll do in a follow-up email. Hannah was asking about like bone health and the relation to like before and after childbirth. So
Mm,
maybe we'll cover that there. And then also one question that Leah had in the chat about the best study for exercising or strength training. So we'll look
lift
into that.
more.
Yeah, you're saying lift more is the best study out there.
That's a
Okay.
great study for understanding osteoporosis, because the former guidelines used to be more walk for osteoporosis prevention, but lift more really changed that paradigm and allowed us to focus more on resistance training and strength training, and showed that women with osteoporosis did not fracture more, and that it is safe to lift heavy.
Yeah.
So the lift more study
Yeah.
for that.
Okay. And then Luisa, thank you so much, who shared some results from a study on GLP-1. So as we were talking about weight loss,
Mm,
weighted vests. Okay, so then we one quick question, which is your thoughts on collagen, because I'm
mm.
also selfishly curious about that. And then the last question is, what does it mean to build a body and really a life that's built to last?
So the collagen question, I'd say, bone is made mostly of collagen. The matrix is over 90% type 1 collagen. So it's a reasonable conclusion to take collagen. I do think there's some real benefits for, say, skin and hair to taking collagen, but collagen's not a complete protein. And so I think it's a reasonable add on, but I don't routinely recommend it. I more recommend, the things that we have good quality, reproducible evidence for, and that is adequate dietary protein intake, which, we know we need more, especially as we get older and through that
Yeah,
hormonal transition, menopause, and then the resistance training and hormone therapy too, for those who need it.
yeah, perfect.
You asked about a body built to last. I
Yes.
think it means, being able to maintain your independence, and with that, the joy that comes in being functional and being able to do the things that you love, be with the people that you love, and to interact with them in a way that feels fulfilling. And whether it means being able to get down on the ground and play with your grandchildren, whether it means going on a bike ride with your kids, or being able to travel and lift a suitcase and go to the airport and these sorts of things, or even communicating and interacting. Cognitive and brain health is so important too. So I think it means being able to stay functional and independent to enjoy your life as you get older.
Yeah, I love that so much. Joy is one word that always comes up in our community. So this is great. Amazing. So thank you so much. This went by really fast, but I love that, we had so many questions from people before and then during the chat. For anyone in Austin, Dr. Reddy will actually join our walk in Austin, downtown Austin, on September 9th. We'll follow up as well in an email for anyone who's in Austin to join and can try out our vest as well. Awesome.
Look forward
Thank
to it. Thank you for having me. Enjoyed
oh,
it.
thank you.
Thank you. Bye bye.
Bye.